Today I wanted to show you how masks are super effective at reducing transmission of the COVID-19 virus, and even when there is transmission with mask wearing, people get less sick or have no symptoms at all, and how that all works. Because yes, masks are very helpful, but they're not perfect. Think of it like deodorant. Very helpful, not totally, absolutely flawless, but we still wear it. Let's do this. To do this, we're going to use animal crackers, and we're going to see how the flavor of the animal cracker changes after it's introduced to the virus. The top rhino will have a mask. The bottom, is it a hippo? Will not. Our beloved friend coffee is volunteering as the virus. And this sifter has volunteered as the mask. So first we're going to apply the same teaspoon of virus or coffee grounds to each of these animals and see which one ends up having more viral particles on them to begin with. So there we go. We have our top candidate. Obviously, friend on the top got a mask, one on the bottom didn't have a mask, exposed to a whole lot more. So this is a lot like masks in that masks they're not perfect. Some of those particles, because the COVID particles are very, very small, and a lot of people are saying it's not even helpful. And that is just, it's not true. It's not flawless, but that doesn't mean it's not helpful. So some of those particles are still going to get through. Some of that coffee ground did get onto the cookie. It's still going to taste a little bit like coffee, but it's going to taste a lot less like coffee than the one that just got everything dumped right on it. So let's go back to our original question. Does the more coffee that's on the cookie, is that going to, what is there a difference between the two? And yes, we saw the one wearing a mask had a lot less coffee, so your body's not going to notice that flavor quite as much. It's still going to be there, still can definitely affect things, but the effect is going to be less. Now let's look at the bottom cookie. The bottom cookie was the one that just had everything dumped on it. That cookie is going to be almost inedible. Your body's going to have a really hard time with it. It's going to be like, I do not like this at all. How does that have to do with COVID? So when you're exposed to something, either a flavor or a viral particle, the more you're exposed to it, the more likely you are to catch it, just statistically. One, because it's less likely, like that flavor has to hit that part of your taste bud to trigger the reaction. And then if we're thinking of viruses, that virus still has to enter your body, and not all the viral particles are going to enter your body. But when you have more of something, obviously your chances of it actually getting in are going to go up. So just like some of your taste buds, most of them are still going to be cookie when you're wearing the mask. With, the coffee, you might taste it a little bit. Look at that like a virus. Your body is going to get a little bit of virus, and it's going to probably be able to fight it off. If you even feel symptoms, you're going to have a very mild infection. But if you had all of that virus dumped on you and you had no protection, your body is fighting off a ton of viral particles all at once, rather than the few that it did if you were wearing a mask. So does mask wearing, is it perfect? Does it prevent you from transmitting particles at all? No, but it does significantly decrease how many particles you can spread. Stick around if you want more info and let me know your questions.